Hey team, we're getting ready to count down.
Ooh, let's have a good show. Good evening. My name is Ryan Wilson. I'm the CEO and co-founder of The Gathering Spot. I'm so grateful that you're here with us this evening to discuss such an important topic. I want to first thank our tremendous partners in this conversation, Emory Healthcare and Emory Hospital, for joining us. Tonight, you're going to hear from subject matter experts. You'll hear from community influencers and all around people that have amazing perspective on what is happening in our community as it relates to COVID-19. My only ask is that if you have questions, please contribute them in the chat. We will try to get to those questions as we conduct all of the panels this evening. What you can expect are 3 different conversations looking at different aspects of how this virus is impacting our communities. And I don't want to waste any time to make sure that we get to good information. So without further ado, I'd like to introduce our first panel. The moderator for this panel is going to be Dr. Monique Smith, and she will be joined by Mark Carnethian, who will be here to discuss the impact of COVID in the Metro Atlanta area.
Thanks, Ryan. And I'm delighted to be joined by Mike. Mike leads the research and analytics at the Atlanta Regional Commission and is the founder of Neighborhood Nexus, which is a community intelligence system that leverages data to catalyze opportunities for the region. Mike, thanks so much for joining the conversation today. I know that you, like myself, are a little bit of a self-described data geek. So I know that within the numbers, there are a number of stories you have found. As a member of the steering committee convened in April by the Emory Healthcare CEO, John Lewin, and the board of directors to address the disproportionate burden of COVID-19 on communities of color, I've had the opportunity to dig into the data as well. And I must admit that it gave me pause to learn that in March, over 80% of hospitalized COVID-19 patients in Georgia were African American, while Black people are only 31% of the population in Georgia. African Americans represent 49% of COVID deaths. Can you tell me a little bit about where we are now?
Yeah, absolutely. And if we can pull up the slideshow, I'm actually going to share a few images with you. Now, one of the things that we've seen, if you can go to the next slide, one of the things that we've seen is, as this pandemic is progressing, we're learning more and more, and our thinking and learning is evolving about how we're getting sick and why we're getting sick and even where we're getting sick. But one of the things that really hasn't changed since the early days of the pandemic is who is getting sick. And so the image that you're looking at now, it looks complicated, but really all it's showing you is that the blue dots represent the percent of the population in Georgia, and the green dot represents the percent of COVID cases in Georgia. So for example, if you look at the Black populations, roughly 32% of Georgia's population is considered to be Black, but they represent 40% of the COVID cases. And if I were to put on another dot about the deaths, that would be right around 48% of all deaths are occurring in the Black populations. And of course, the inverse is true for the white population. So what you learned about in early March hasn't really changed much. Let's go to the next slide. And so, what I was sharing with you is just data from Georgia, but this is not a Georgia thing. It's not even a Southern thing. This is the black populations are being impacted disproportionately in everywhere in the nation. And let's go to the next slide. And if you start looking at this by age, the disparities become even more stark. So if you look at that, that youngest age cohort, the 35 to 44-year-olds, while there's not a lot of deaths in that age cohort, but of the deaths that there are, Black populations are 10 times more likely than white populations to die from this disease in that age cohort. And then finally, let's go for one more slide, and then I'll turn it back to Monique a little bit. These are maps that the Georgia Department of Public Health created. It's been a couple of months now, and I don't think they've been updating these maps. But what you'll see, number one, you'll see that big dark red area in southwest Georgia. That's an area that's still suffering disproportionately from COVID. And that's also, majority people of color living in those areas. Now, if you can squint and kind of focus in on Fulton and DeKalb, you'll see sort of the same basic spatial pattern where areas of South Fulton, Clayton County, South DeKalb, those are the areas that, at least early on, saw the most numbers of COVID cases, and those are also areas with the heaviest concentrations of people of color. So in the short answer, Dr. Smith, is really the same folks that we've been diagnosed early on as having a disproportionate impact are the same folks.
I hear you. And I think a lot of what we think about as well is the burden of chronic disease. I'd wonder if you could tell me a little bit more about, how populations who have this higher burden of chronic disease and other vulnerable populations have been affected by this pandemic.
Sure, yeah, and we'll go back to the slides now. I mean, obviously, there are some comorbidities here, and it's not just people of color that are being affected by this. It's obviously older people too, and that's sort of stayed consistent in our learnings about this. But what I really wanted to talk about is a different type of vulnerability, and this is really getting to, I guess, the new essential workforce. Those are the folks that, unlike many of us, were not able to work from home. They had to go in. They were not able to shelter in place. They were not able to quarantine. So they had, and then, we're talking about frontline health workers just like yourself, Dr. Smith, but we're also talking about folks who work in the restaurant industries, both full service and limited service, and temporary help. And so that's what this chart is showing. And then one of the things that I wanted to point out, other than there's lots of dots and lots of things going on here, is that not only are those industries that are most threatened by the shelter in place orders, not only do they employ a lot of people, they also make among the lowest wages of all the industries that are threatened. And so that's really sort of, now we're beginning to blur the lines between sort of that health side of the crisis and blurring it into the economic side of the crisis. And let's go to the next slide, and I'll show you a couple of more things that we've been looking at. If we can go to the next slide. And so this has a very distinct spatial pattern. And so if you look at the map here, these are the percent of threatened workers. And all this is just where workers live who happen to work in food and accommodation and arts and entertainment. Those are the industries that have really just have suffered the most job losses. And what you'll see is the dark browns represent the heaviest concentrations. And if you'll keep clicking through, I'll show you some other maps that kind of show you how these spatial disparities and the neighborhoods, and remember, when we talk about neighborhoods, we're talking about people. And so you'll see the map that just popped up. Those are the heaviest concentrations of people of color. Let's keep on clicking. And you'll see the percentage of low birth weight births. Again, those browns and reds represent the highest percentages of that. And that's just sort of a proxy measure for general unhealthiness in the population. Let's click one more. You'll also see people lacking health insurance. And let's click one more. And then the next map will show you the percent of poverty. And what you're going to see is you're going to see a lot of those same neighborhoods on the map on the left are the same neighborhoods that have sort of these co-conditions of poverty, of general unhealthiness. And again, this all comes back down to people being affected. And so now the vulnerable populations, not only, well, when you talk about the public health side of it, yes, it is people of color who are most vulnerable. But it also so happens that if you start talking about the economic side of the crisis, it is also people of color. And so let's go one more slide. And this is just another map showing, where low income employment is declining. Again, the darker the color, the greater the decline. And then let's go one more. And so if you kind of get all of this into a chart, what you're looking at is if you look at the 100 most economically vulnerable areas, and so those are the areas with high concentrations of workers in food and accommodation and arts and entertainment, you can look at the racial and ethnic breakdown of those, and it's a majority people of color. It's, about 30% of the people living in those neighborhoods don't have health insurance. And so what this means, Dr. Smith, is Atlanta came into this pandemic with some of the highest levels of income inequality in the nation, some of the lowest levels of upward economic mobility, and some of the most racially segregated neighborhoods in the entire nation. And what this pandemic is doing is not only exposing that, it's actually amplifying these disparities and inequities.
Mike, I hear you. And the data is extraordinarily clear that we really have a high at-risk population in communities of color when it comes to the medical impact of COVID as well as the economic impact of COVID. I'm really impressed by the way that you represent data and the ability to visualize it. Are there places that our listeners can go to see the data more clearly and understand as things evolve?
Yeah, absolutely. Let's go back to the slides and I'll finish it up here real quick. Now, in just terms about the overall economic impact, let's go to the next slide. There's not a lot of consensus out there. And so what you're looking at is sort of economists' views of how this economic impact is going to play out. They're thinking it's going to be a rather slow recovery. Let's go to the next slide. And then what we're seeing is, somewhere around 530,000 jobs lost in the metro area. Let's go to the next slide. And then summing up, and so yes, there's going to be an economic impact, and it's going to be, we're thinking roughly there's about 18 to 20% unemployment rate, which equates somewhere around $1.5 billion in wages lost per month, and about $6 billion in lost sales per month. And that's without the stimulus. And then let's go to one more slide. And then we also have to consider other impacts that COVID is laying bare. Things like education. We've already seen a study just came out that's showing that, kids are losing third grade reading proficiency and eighth grade math proficiency because of the shutdowns. We're seeing childcare centers, the majority of childcare centers are closed and they may not reopen. Food insecurity is going to be a big issue because schools are closed. And so we're collecting all of these information and collecting all of these stories. And I do want to, if you go through the next 3 slides pretty quickly, I do want to share some resources with you. We do put together a COVID weekly report that kind of summarizes everything week by week. Let's go one more. Emory has put together a great interactive dashboard that lets you look county by county at, all of those social determinants, all of the racial injustice that's happening and how that's playing out in this disease. And then let's go to the final slide. There's also a bunch of resources on Neighborhood Nexus. And so I do encourage everyone watching to jump on these resources because you can learn an awful lot, and there's lots of stories to tell, and there's going to be lots more stories to tell as we continue to figure out what's happening to us.
Thanks, Mike. I really appreciate your perspective. It's great to dig into the data a little
Thank
bit,
you.
which really will lay the foundation for the rest of our conversation today. Ryan?
Well, thank you, Dr. Smith. And Mike, we really appreciate that conversation. It was really insightful. I learned a ton. We're going to move to our next panel pretty quickly. And I'm lucky to call both of these two individuals friends. I'd like to welcome Shanti Das and Mohammed Masakwai to the conversation.
Hi.
How are you? It's good to see you both.
Likewise.
Thanks for joining us this evening. First and foremost, I just want to start out by just asking, how are you? I know that with so much going on, that question has taken new meaning for me. How are you both doing?
So I'll start, ladies first. It's a loaded question, to your point. I take it one day at a time, Ryan. I think, we're over 4 months in on the pandemic, and then we had another pandemic within a pandemic. And so my emotions are high. I am also still grieving the loss of my sister who passed away last year. And I live by myself. So the isolation is tough at times, but I'm trying to stay as positive as I can. I recognize my voice in the community. And so I'm doing the best that I can to push our culture forward.
Yeah, and I'd agree with what Shanti just said. The last month's been heavy. It's been foggy. It's been difficult to focus at times. But then in giving, myself grace to check out and have those moments of clarity and have those moments to meditate and have those moments to pray, just to get back to balance so that the realities of the world don't take you by storm.
Mm-hmm.
Yeah, absolutely. I mean, I'm similar to y'all. This has been an extraordinary couple of months for me, but I want to go back to the beginning of the pandemic, before it was even labeled as a pandemic. What were your plans for 2020? And then can you walk us through how those plans have changed and how the pandemic has impacted you?
So
And
for
Shanti,
me,
let's start with you.
Okay. So for me, I am the founder and executive director of Silence to Shame, which is a mental health organization here in Atlanta. And we focus on mental health around communities of color. And, we had a lot of events planned. May is Mental Health Awareness Month. And, we had a lot of community conversations in person and fundraising efforts. And so obviously all of that was canceled. I also speak on the side to corporations around mental wellness, and to have all of that literally pulled from right underneath me was a hard pill to swallow. As an entrepreneur and someone that works in the nonprofit space, I don't make the same money that I used to make in the music industry. And so not really having, the ability to curate these events and to even go out and speak, is detrimental. And so it's been a hard lesson. I have learned a lot of lessons through COVID-19, and I know we'll get to that later in terms of some things that we should be doing in terms of best practices, but all of our events essentially were canceled. Luckily, we were able to move some virtual, but it was really tough not being able to do a lot of our in-person events.
Absolutely.
Yeah, like Shanti, I do a lot of my work in person. I do organizational change management. And so a lot of times that's on site where clients are flying. And that's non-existent now. And when the pandemic first started, it was like, okay, I had to figure out ways to be busy. And then there was the second phase of it, like, wait, I'll never have this moment again, just to be still. I have a 13-month-old daughter. So being able to see some of the monumental moments, her walk, her talk, her have more attitude, I would have missed that. So it's put work-life balance back into focus. And then the big thing is just reinventing in terms of what is possible next. How do you add value in different ways? How do you prepare for the next crisis? How do you position yourself so that you separate yourself and you're the best at what you do? And so that's the phase that I'm in right now. And it's been tremendous for clarity and for growth and value add.
No, I appreciate both of your answers there, and I think that to a certain extent you started to go into this next question, but I want to pull out this specific topic, and it's just around positivity. I have found it at times to be positive during this entire crisis. How have you personally continued to stay positive? And then for the work that you do, what advice do you have for folks watching on the best ways for them to stay positive as well?
So I've been able to stay positive by doing a lot of what I tell people on a daily basis, and that's practicing self-care every day. I wake up from a place of gratitude, just thanking God that I'm alive today, that my family's okay. And then I try to keep a regular routine, Ryan. I get up and I take a shower. I get dressed as if I'm going out, even if, I don't drive my car for a week. So I try to, just, again, keep that practice going and come from a place of gratitude and wellness. And it's actually helped me out a lot. And being able to encourage my friends and family, we've kind of set up this accountability partner system so that we check on one another on a regular basis and on a daily basis. And I think that would be my advice to a lot of people is, it's not enough to just check in on Facebook and IG, because, we all have our friends and we're like, oh, I talked to you on Facebook, girl, you seem to be doing great. Okay, it's nice for the perception of the job, but you really need to pick up a phone and call somebody, and that family member that you hadn't seen, consider FaceTiming with them. I have a mother who is 88 years old in a senior care facility in Charlotte, North Carolina, so it's been extremely difficult not to be able to see her. But of course, I'm glad that her facility is COVID-free. But I am, FaceTiming with her, and again, just finding ways to stay positive and grounded in the moment. And I also, just pivoted because I felt like I was going through a lot of anxiety when COVID first hit. And I just took the first Saturday that we were all kind of, having to quarantine and stay home, excuse me. And I prayed for like a couple of hours, and I was like, God, how can I still use my ability to touch other people and to encourage them from a wellness perspective? And a new brand, Yeah Wellness, was born out of that. And so now I interview celebrities and influencers, and it's really kind of turned into a thing. And it's allowed me to pivot my speaking business to start doing virtual webinars and creating conversations for corporations around wellness, and even being able to just help different community organizations. So I did try to find the positive, like Muhammad, out of this. And now I have a new brand on the side that I can work alongside Silence the Shame.
I can say that I've listened to a ton of those conversations over the last couple of weeks, and so thank you for that work. Yeah, Wellness is it feels like a brand that's been around for a while, and so I think if you haven't watched, please do consider watching some of those conversations. They're phenomenal. Mohammed, what about you? How have you been able to stay positive during this time?
Well, no pun intended. I had the crash course in this a couple of years ago when I had the ATV accident and I lost my left hand. Mm-hmm. And through that process, you realize that you have to stay around good energy. That's what you consume, the people that you engage with. So now my circle is built up of people that genuinely want me to win and don't want anything in return. And so they're constantly feeding into your spirit. They're sending you articles. They're updating you on things. They're making introductions. Just pushing you forward to become the best version of yourself. And the other part of it is that, sometimes we're looking for inspiration and we already know what we're inspired by. So we should connect to those things. So I read up on people and things that push me. And what you see is that they all have these different hardships that they've had to overcome. And that just lets you know that like life isn't going to be easy. Sometimes it throws more challenges your way, but you have countless examples of people that have been able to overcome. And so it just lets you know that you'll be okay as you continue your journey.
I want to transition the conversation to some of the statistics that we just heard in the previous conversation. There were a ton of stats that were offered that are, frankly, for me, scary, right? But one thing that's consistent through all of them is that Black folks, particularly in this city, are being disproportionately impacted by this virus. What advice do you have to communities of color, given where the virus is, currently in our communities? And then after that, I want to talk about prevention. But what advice do you have, given the stats that are out there, in particular for Black folks, given what we just heard?
One of the things that I'll just say, Ryan, is I want our Black brothers and sisters to know that this is real. Not to be judgmental, but when I get on social media and I see a lot of the conspiracy theories, and people have a right to believe what they want to believe, but I've, been personally affected. So many people probably even, that are participating today in this webinar have been affected. I have a friend who lost her mother and her grandmother within 2 weeks. First and foremost, COVID-19 is real and it is affecting our community at alarming rates. So what I would say is, we're starting to open up and ease restrictions, is that we don't let our guards down too quickly. I think it's really disrespectful when I see people out in public and we're at the grocery stores and, at the drugstores, and people don't have their masks on, and they just really feel like, oh, well, I'm a young person, it won't affect me, or I'm an older person and I'm not sick, I feel okay today. But you need to educate yourselves. We need to continue to educate our community so that people understand that you could be asymptomatic and still pass it on. I read numerous articles about, how people are out on the beaches and in clubs, and then a couple of weeks later you have all these folks that have gotten infected. So wear your mask, be thoughtful to one another. And then also, we really need to go and check in on our elderly community, people that live in food deserts. So one of the things that I'd like to announce today is I'm starting this new hashtag, Support Black Fridays. And it's an opportunity for some of us that are influencers and celebrities and people that have more disposable income in the Black community to pay it forward on Friday. Maybe you buy 10 masks and deliver it to a senior care facility, or you buy some groceries and drop it off for someone. But I'm going to challenge you, Ryan. I'll start this Friday, but if you can start next Friday on July 3rd, let's support Black Fridays and really take care of our communities, because again, we've heard from the previous panel, all the disparities within our communities, and we don't have the same access to hospitals. We've seen a lot of the hospitals on the south side of town that don't have the proper PPE equipment. So let's do what we can to try to bring these resources to the community.
One thing I think is just empowering each other. You did something really powerful the other day for your birthday. You made the call to challenge people to support Black businesses. And so just in supporting each other holistically, whether it's making sure we improve our healthcare as a unit, our wellness as a unit, the way that we attack mental health as a unit, the way that we support each other's businesses, the way that we share information with each other, the way that we want each other to win. I think just the pandemic and just the racial tension right now is a question for us to continue to strengthen the unit as a whole. And if one person wins, not to hate on them, but to want them to win even more, because they're going to pull and rise the tide for everybody. So just supporting everybody holistically is, I think, what helps not only with this pandemic, but just in life as we try to do better for ourselves in general in this country.
No, I appreciate both of your comments there. And Shanti, we're all in any challenge you have for our community. You know that we're going to be in full support of it. But I want to ask a follow-up question to just staying on this topic from an influencer standpoint, because Shanti, I'm like you. I'm nervous when I go out, go to the grocery store. I was in a Target not too long ago, and there were a number of people that were not wearing masks. Both of you understand the power of influence. What should we do? Shanti, we're absolutely going to take your challenge. But what other things can we do to try to make sure that this message around being safe in public is adopted and hopefully helps us get to the right side of this curve?
Brian, I'll say I'm going to accept your challenge as well, and I'll make sure I support a Black business this week in post. And so, to your point, it is using our voice for good. Those of us that have a really active and engaging, following on social media, we have to make sure that we're, not just posting selfies and, random information, that we're really bringing the information to the community, post real life situations. Like I went for the very first time to the hair salon today. I was so afraid. I have not gotten my hair washed in a hair salon in 4 months, but I made sure that I even wore 2 masks and I wore my gloves, but I posted right after it, and not just to post a picture of me getting my hair washed. I told my followers specifically that I was very cautious and that I wore my mask. So, you have to lead by example, right? And so I think being able to, again, utilize our voices and our pages to show people that we are doing the right thing, that we are trying to give back to the community, and that we take this serious. I mean, for one of the things, again, that's been bothering me is not being able to see my mother. And so even being able to have community conversations around people that have, elderly people that live with them, getting them to understand that, if you want to go out to the clubs and hang out, that's cool. But what about the mom that may be living with you? And I think sometimes a lot of people in the community, they don't understand the repercussions that, would happen for older family members. And so, again, being leaders in the community and being able to lead by example, I think is the best thing that we can do.
I agree. Just sharing information in a simple way so people understand, and seeing some of those statistics. was shocking to me. I didn't know. So the more that we have access to good data, the more that we understand the reality of what's going on, the more we can help people make informed decisions. Because you hear, oh, it only affects old people. Oh, it only affects this demographic. It affects this. And it's an unnecessary risk to take to go put yourself out there in an environment when you don't know. So just continuing to share information in a simple way, and hopefully people will receive it.
My last question, and I want to draw upon y'all's backgrounds in entertainment and in sports. There's been a lot of conversation about the future of both of the kind of sporting and entertainment industry broadly. What how do you see the industries pivoting, right, in the short and long term? And what do you hope to see specifically when we look at the short term efforts as it relates to COVID-19? And Mohammed, we can maybe start with you. In sports, what do you hope to see in the short and long run?
Well, I think it will be, if they open up sports, everybody that's involved will get it. To what the effects of that is, I don't know. But if one person has it, everyone has it without a vaccine. I think that the digital landscape will become, but I think that once the world opens back up, the ability to be somewhere physically will be a premium, and people will want a premium experience. And the people that can deliver on that will be of tremendous value, because people have been cooped up. Nobody literally wants to be home, but we're forced to be home because that's a smart thing to do. So when we are able to see people face to face again, we're going to want a really dynamic experience because we haven't had it in a long time. But from the sports side, even what the NBA is doing in trying to quarantine everybody down at Disney, you still have workers that are coming and going home. You still have people that do food, all of the stuff. I just don't know how they contain it. And that's coming from the college space where they've done everything possible, have all the resources, and these kids are getting COVID left and right. I expect to see the same thing on the pro level.
And I'll just add, in the entertainment community, we've heard companies like Live Nation and other record companies talk about the touring industry being put on hold until 2021, perhaps even 2022 in some instances. And so, our artists and creatives are going to have to get more creative, if you will, pun intended, because I think, you'll find virtual fan experiences, right, being a premium opportunity. So being able to create those private concerts and one-on-one engagements with your fans, I think is extremely important. And just, understanding that, when you are able to, maybe have a pop-up show, if you utilize a drive-in theater, like, I can't remember which artist it was, but I saw someone that was like up on top of the screen in a drive-in theater, and people were honking their horns. And so you were able to socially distance if you were a fan in the parking lot. So artists have to get creative to do stuff like that. But when they make some funds, you got to put some money away. I hate that the entertainment industry is, not that I hate it, but it's a braggadocious, aspirational kind of business. So it's a lot about flossing and what you're driving and what you're wearing. But one thing we've all learned, I think, through this experience with the pandemic is you really can have the same pair of pants, same pair of sneakers, and none of that really matters. Your health is all that what matters. So I want people to put money aside. And I want to say this to the Black community, whether you're an entertainer, an athlete, or just someone in the community, you got to put some emergency funds away so that if we get into this situation again, the government is not able to give us a stimulus check right away, that we do have some emergency funds on hand. And also that we take advantage of a lot of these funds that are out there right now through some of the larger corporations. Whether it's cool or trendy, a lot of corporations now want to give Black, quote unquote. And so being able to, going back to Muhammad's point, sharing information, we have to let the artists and creatives and people know that money is out there, but you have to know how to apply for it and when to apply for it. So being able to, share the information and really understand financial empowerment and savings, I think is important.
Shanti, I think you're so right on the Zoom part in terms of being creative. I've never worn so many suits with pajamas ever during this time period. My last question for y'all is, can you tell us the best way to connect with both of you individually, and any parting words or words of encouragement that you have, particularly as it relates to folks that are concerned about this virus?
Muhammad?
Man, I think that what you're doing is so transformative. It is, we come from communities that we don't always get a chance to have access to this high quality information. So just thank you for what you do for the city and the culture and the world and so on and so forth. I think that an interesting time. I think people are hopefully at scale understanding the value that Black people can bring to the world, that we have brought to the world. And I think as Black people, we should continue to that we bring tremendous value for the world and not to sell ourselves short and go out and bet on ourselves and believe that we can do things. And just seeing like how dynamic this city is. I'm from Charlotte, and chose to live here just because of how many people were doing things at a high level and being able to see people that inspire you and is for other people. And so those would be my parting words, just to continue to operate at a high level like we always have and continue to believe in each other. I'm easy to find. My name's very unique. So if you type it, I'm usually the first person to pop up and let you catch my dad. So on any social media, you can just type in my name and it comes up. My handle is Iron Massaquoi. But just thank you once again, man. It's an honor to be on here with you.
I appreciate you. Thank you.
I too echo the sentiments of Muhammad. Brian, I think you know how I feel about you and TK and the Gathering Spot and the sense of community that you guys have brought to the Atlanta city. I was born and raised here. And so to have an opportunity to be one of the founding members and be a part of a lot of the history making events that you guys curate is really more than a blessing to this community. So thank you for that. I can be reached on Instagram at ShantiDas404. That's where you can find my Wellness conversations. Also, please consider following Silence to Shame at Silence to Shame. We curate a lot of really great conversations for the community. So my parting words would be, continue to take care of your mental health. We, especially as Black Americans, have been going through so much these past 4 months. And what I don't think people are realizing is the after effects, right, of the pandemic, as well as everything that we've seen with the racial injustices that's going on with the deaths of so many Black female and male African Americans. That trauma, right, will linger. So limit your media exposure, right? I don't need to see the shootings over and over and over and over again, because I know I'm going to constantly be anxious. I may even have nightmares from that. So if you have never considered therapy as a Black person, know that therapy is not just for white people. It's not just for Asian people. It's not just for Indian people. Therapy is for everyone. And you don't have to just seek therapy when something is wrong. It really could be an asset to yourself. So consider understanding that it really is the mind, body, and soul. It's about what we eat. It's about how we think. And it's about how we take care of our mental wellness. So please do everything you can to silence the shame around mental health in your life and in the community. And if you need help, just know that help is out there. And July is Minority Mental Health Awareness Month. So hopefully we'll be able to continue to spread this message around mental health through both of these pandemics in our community.
I appreciate you both. Thanks so much for spending the time with us. And thank you for support of the Gathering Spot. It means a tremendous amount to me personally. But the information that you shared tonight and the platforms that you continue to build and the information that you share doesn't go unnoticed. So anyone watching, please connect with these individuals. They're doing tremendous work in our community and will continue to do so as it relates to this topic and many others. But I appreciate y'all and look forward to seeing you soon.
Thank you.
For sure.
Okay, so for our next conversation, I'm super excited. We have two doctors coming to participate in this conversation. So I'd like to first welcome Dr. Tina Ann Thompson. She is a doctor at Emory University, and then Dr. Angelica Ferguson, who is the Chief Health Officer for the City of Atlanta. How are you both?
Hi, well, thank you.
And Walter, I'm so sorry. Walter, how are you?
Good, Ryan. How are you doing?
It's good to see you. We also are joined by Walter Samuel. He's the Delta Healthcare Strategy Leader. I appreciate you all being here.
Thank you for having me.
I want to focus this conversation on getting back to business. I know that that's been a big part of the conversation here in the state, and we made moves early in the state of Georgia to get back to business. And so I want to examine some of the implications of that decision. I'm going to start first with Dr. Ferguson. what can we learn as business leaders from the city's phased approach to reopening? And what resources should we take advantage of as we're preparing to maintain safe work environments?
So, as Chief Health Officer, I lead all of the mayor's health initiatives as well as the mayor's pandemic coordination team. And we have used data, we've used a community approach, really paying attention to what's happening within the community and paying attention to what's happening with the numbers. So as I was listening to everyone speak, anytime I hear Shanti speak, I just want to like clap and run through the room and all of that, simply because, and thinking about the numbers as well, right? I think what a lot of people don't realize that folks, within our community between the ages of 18 and 29, they have the highest number of cases of COVID, 18 to 29, as well as those who are 30 to 39. These two groups have the highest number of cases in our city. And then when we talk about what's happening in our community, 52% of the cases come from our community, as well as 87% of the deaths. So we talked about these numbers earlier. We can't afford to skip out and not follow the data. We can't focus on dates. We can't focus on a timeline. We have to understand what's happening with the pandemic. And that's what we've been doing. We've been using a community-based approach with our reopening plan. We've been looking at the phases, and we're trying to make sure that we're not moving too quickly when it comes to opening city hall, city facilities. And we can do what we can under the state's orders, but we have to be honest about what's happening with the data. So that's been our focus. So anything that I would say to members of our community, follow the numbers. We all saw that a tweet went out from our mayor where she talked about the statistics and the fact that Georgia had some of the highest cases of COVID since the pandemic began just a couple of days ago. So we need to listen and follow that. That would be my first thing. The other thing that I would say is pay attention to what the guidelines are coming out of the state, local partners, and then federal partners. There are certain guidelines that you can put into place as business owners within your company. So of course, we want you to wear a mask. We want you to wash your hands. But there are some key things specifically for businesses that you can use. So follow those things and keep that in mind. The other thing that I would want people to know is use the ATL Strong website. I don't think people really know about it, but the ATL Strong website outlines our moratoriums around evictions, water terminations. Visit the investatlanta.com. That website outlines all of these programs for grants and business loans. Whether you are a creative, you work in the entertainment industry, the beauty industry, as well as salons, barbershops, so on and so on and so forth. We've outlined programs and resources and funding that's available to support members of our community during this time.
And just as a quick follow-up on the phased approach, can you just give us a little bit more detail in terms of what phase are we in right now and what timeline? I know that it's hard to predict in many ways, but based off of the data that we're seeing now, how long will we be in this phase? Is there a chance that we may go back a phase?
Ryan, really? Why you throw that question at me?
As a business owner, first I was confused about the phases so I'll speak for myself for a second. But I think that there generally is just not an understanding about what each phase means. Not necessarily the content of the phase.
I got you.
But just like, is it appropriate for the business owner to be, if the city's at phase 2, can I be in phase 3 or should I be in phase 1? Talk to us about what you can about the phases.
Absolutely. So when it comes to the phases, it's really about guiding where we are when it comes to ordinances, executive orders, city-led initiatives, and then to provide members of the community with accurate data and information. So that's the biggest focus. Overall, we have to follow the state orders, but the phases offer some key guidelines on how, for people who want to move slowly, to reopen their business. That's the key thing. So outside is open, but we would hope that you would move slowly when it comes to phasing out or phasing in your business for different services. That's the main thing. So currently we are in phase 2, with the focus on gatherings of no more than 10 people in one space. We have put out, I think, orders around takeout, different things like that. So the phases offers information on how to open things slowly for your business or for your groups. But like Shanti mentioned, it's a time to get very creative and to be able to do things. And the ATL Strong website is a great resource for you to be able to know what's coming out of the mayor's office, what kind of initiatives are we holding, and then what executive orders are in place. Most people don't know that we have rental assistance and housing programs that are specifically aligned with COVID. There's so much information and a lot of resources that are available, but most of the time people don't tap into them. And so that's what it is.
Mm-hmm. I appreciate you. So what I took away from that is that if the city's in phase 2, you shouldn't be in phase 4, and pay attention to the guidelines. Walter, this next question is very personal to me. I spend a lot of time under normal circumstances on Delta flights. I'm proud to say that I'm Diamond, and I was very happy to see that I'm going to continue to be Diamond, I think, for a little while longer, because I got nervous when I wasn't going to fly.
We appreciate you.
No, I'm loyal to the company for sure. I'm going to fly for the first time in 2 weeks since COVID, since the mid-March. Can you talk to us about what Delta is doing to ensure that travel is safe, and what other pivots the company has made over the last couple of months for people like me that may not have been on a plane in a while?
Yeah. So one of the things that's became really clear was whatever we had planned for the next few months was out the door. And obviously, given that we're air travel, we were immediately impacted by people who understandably don't want to put themselves in harm's way in terms of traveling and going to different places. So what we've really tried to do is really kind of own the clean category for airlines. So everything we've done has been a huge focus on bringing back customers, understanding kind of the pain points and potential exposures you can get with COVID, and really relying on assistance from healthcare officials. We've received guidance from the CDC, from other areas to kind of create our strategy for how we think about spacing in terms of the plane. So now we're running planes only at 60% capacity, so people have plenty of room to spread out. We have packs where previously you would get all these things from the flight attendant, so you have a pre-pack with all the items you need for your flight, refreshments, etc. And then going into the gate, we have clear markers for essentially to show that you're 6 feet apart from each other. So lines to demarcate it, because we want customers to be able to understand what safety looks like and how close you can be to somebody, because I think there's a lot of ambiguity around what that is. So we want to put customers at ease and kind of build customer confidence around that. The second piece is where we've made masks mandatory for customers and for all our employees. So that's everybody from the customer service agents to the people working on planes to the baggage handlers. Everybody has to wear a mask. And just to kind of spin it forward a little bit, we've done a ton of work around protecting our own employees, because we see it as a single thread. We want to protect our customers, but we also want to protect our employees. So we've done a lot of measures to really provide guidance to employees in terms of if they have a potential exposure, where to find care, If somebody is particularly vulnerable, we have what we kind of call high risk pay protection. So essentially, we're telling you if you fall in a certain category, you should just, and you're a frontline worker, you should not be in the workplace, because being in the workplace exposes you uh, to COVID and could potentially, put you at risk. And I know a lot of the motivating factor for people to come into work is obviously earning a salary. So if we put those people out of harm's way, um, and allow them to quarantine and isolate and not risk being in a area where they're potentially exposed, that's had a big impact on kind of how our employees view it in our COVID response efforts.
Thanks, Walter. Dr. Thompson, I want to shift to you. And we're going to move from airplanes to physical locations. What is the bare minimum that you recommend that physical brick and mortar locations should be doing? And what are some common misconceptions that you've seen out there? I feel like over the last couple of months, I've been sold just about everything in terms of new technology that I thought I'd never heard of before, but apparently almost is the cure to the virus. So what things should we not be doing, and what things do you recommend that businesses put in place?
So thank you for inviting me, Ryan. And let me just start by saying this is complicated, right? And it changes. And what we talk about today may be different in a few hours, as well as it could have been different a few days ago. I just want to start with what Shanti said, which was that it is respectful to wear a mask. And so that's the number one thing, right? So we need to be masking. The other thing we need to be doing is being creative. So whatever can be done remotely should be done remotely, right? If you can possibly get your hair done remotely, that would be great. So the brick and mortar places really just need to make sure we're limiting our space. Ideally, Shanti was the only person in her hair salon that day or today. I know when I went to my beautician, I was the only one in the hair salon that day. When I take my 15-year-old son to the barber shop, again, he and his barber are masked. His barber wears a face shield to protect him even more. And I understand that men have the area behind here that has to sort of get right. Yeah. So I'm learning. And so we all, exactly. And so we all have to get creative about how we stay masked and still get that area back there. Or we just maybe need to let it be just a little bit a shot. So again, the masking. The other thing is the cleaning afterwards, right? And before, and allowing our customers and our clients and our patients to be able to see what it is that we're doing to keep them safe. So when we clean the blood pressure cuff, when we clean the razor, when we clean the chair, or whatever it is that the client or person has to touch, it is actually meaningful. It's good for the business. It's good for the client to feel safe, because we do need to make our clients and our patients and everyone feel safe coming back to us. So that is part of what we need to do as bare minimum. Let them see what it is that we're doing to keep them safe. I've heard lots of things about air purifiers, and I've heard checking temperatures and things like that. Can we, should we? It doesn't hurt, but it's probably not going to help as much as wearing our mask, not touching our mask when we wear it, sanitizing everything that we touch, and constant hand washing. Allowing our employees to go and wash their hands multiple times. We might need longer breaks because we are going to have to wash our hands for 20 seconds. And we might need more frequent breaks so that we are deliberately saying at the top of the hour, at the 15-minute mark, at the 30-minute mark, we are sanitizing our hands, and we're doing that for your safety. So maybe we're not rushing back. Maybe we're not seeing as many clients as we were. But and again, to Walter's point, we're flying at 60%. So we might be coming in at 60%, but we're going to get creative in some of our brick and mortar businesses to be able to give service even remotely. but I can keep talking. So the other part that I want to say that businesses can do is to acknowledge that even though we're going to be operating at 60%, that we actually, there are resources available, as my predecessors have said, there are resources available to help us with that. The other thing that we need to do is to make sure that we're outreaching to our colleagues and our friends, because shared resources are so valuable and important at this time. I know in the healthcare industry, a lot of folks are feeling a little nervous about coming out of their homes. We've told folks to shelter. And again, it's up to us to make sure that folks feel safe accessing their care, coming in to get their hair and nails done. But again, we need to do it in a very safe manner.
I totally agree. Some of the questions that we've gotten at the city has been around the guidelines, what some of the key things that we could put into place, questions around mental health. I'm happy that that was brought up. I know that there are some key resources that are available that could be shared. Hopefully we'll be able to share that through the chat to everyone, but just certain hotlines and resources and information that could be available.
So I'm so sorry, y'all. In the world of COVID, you never know what to expect. And one of the things that just happened here is we lost complete connectivity. But I'm back, and want to just ask this last question. I'm sorry for anything that I just missed, but going back to Dr. Thompson's advice around what companies should do. Who have you seen that has done this right? Who's been doing a good job that we should be able to look to as examples?
So I have to say, I did not go into the barbershop with my son, but I stayed outside and peeped. I think they're doing a pretty good job. The ones that I've seen, my husband and son go to different ones, they're doing the masking right. They're doing the sanitizing right. And I think our nail salons are also doing a lot better with the plexiglass and with keeping that social distancing, so avoiding the congregating and limiting the amount of people in their spaces. I also feel like some outdoor some outdoor restaurants are doing things correctly, right? So I see them sanitizing the tables and the things that other folks are touching. I've also seen folks not allowing a lot of the doorknobs to be touched and really guiding the clients through to be able to avoid interacting and touching various things that other folks might touch. So those are just some of the few things that I've seen. I've also seen, I think our healthcare systems are doing it pretty well too, limiting the amount of patients that are coming into our offices and trying to do as much remote and creative care as we can.
I want to thank you all. Before we close, do you mind going around and just giving, again, where the best place for us to be able to contact you, maybe online, and any parting thoughts as, again, we're all wrestling with the best way to combat what's happening with this virus. What advice do you have to us generally about the path forward?
So I think the path forward is slow, and it's making sure that we're looking behind us as much as we're looking forward. We need to make sure that we're willing to change should things not go as well as we are hoping that they would. The research is out there, and we need to make sure that we avail ourselves of multiple sources of data, because I think the interpretation of data is something that many people have been creative with, and so it's up to us to make sure that we're using multiple sources. I'm easy to find at Emory Healthcare and any of the Emory Healthcare websites. Tina Anker Thompson also pulls up pretty easily in Google. Yeah, thank you.
Thanks for being with us. Dr. Ferguson.
One thing I would just want to say again and reiterate this, that COVID is very real. I know that when you haven't been impacted by COVID directly, it's very easy to feel as if it's so distant. But the reality of it is that it's affecting our community. It is here, it is in Atlanta, and that we have to take it seriously. And even if it comes to wearing a mask, you know us, we can get as creative as we want to be and be fashionable and do all of that. But, wearing your mask, washing your hands, using hand sanitizer when it's available is the way to prevent it and protect yourself, as well as protecting the people that you love and care about. So I would say take it seriously, use the resources that are available to you, tap into your social networks and your community like never before. Take care of your mental health. I can be found at Dr. Angelica DRPH on all social media platforms. That's Dr. Angelica DRPH. And thank you so much for the opportunity to be here.
Thank you so much. Walter, can you close out this section for us?
Yeah. So the final thought I have is not to belabor this, but please wear masks. Please wear masks. And some of the businesses that I've seen that have actually kind of differentiated themselves have provided masks to people even if they don't have it, and it's always mandatory for people to come in. So I would think about doing that too as a business if there's budget within that, really providing masks for people just to give people another sense of security for what they're about to venture into. And the other thing I would say is you've just heard from a bunch of medical professionals who are providing real data, real guidance. Listen to the experts and guide what you're doing, what your decision making is. And lastly, there's a couple of different forums and guides for kind of return to work that I've seen that have been really good. I can help provide those to people, and it kind of goes through some of the CDC protocols, but also takes other data sources and other things into consideration in terms of what industry you're in, and it really kind of provides like a step-by-step guidance in terms of what you need to think about for a return to work. And lastly, you can find me on LinkedIn, Walter Samuel II, and then on IG is Bay Black ATL. So thanks once again, Ryan.
I appreciate all of you, Dr. Thompson, Dr. Ferguson, and Walter. I will see you soon on a Delta plane. Thank you so much for sharing your knowledge and insight with this community. We will continue to make sure that all the topics that we discussed in this section are highlighted. And I think if there's one takeaway that I received, which is the one that I think we all need to be receiving each and every day, is wear your mask. And that is the best thing that the business community can do at this point to try to help slow the curve. So thank you all for being here. We're going to transition to our last panel of the evening. And I'm happy to welcome Dr. Smith back to moderate this conversation. We're going to be talking about the public health effort and hear from another group of amazing panelists on the best way to understand COVID-19 from a public health perspective. Dr. Smith, take us away.
Awesome. Thanks, Ryan. So I'm happy to invite into the conversation Teniola Mujobi, who's the communications lead at CORE Atlanta. CORE is an NGO that's doing some fantastic work in our communities to make sure that people get tested, as well as Dr. Xanthia Wiley, who's an infectious disease expert from Emory. So thank you both for being here and being part of the conversation. Dr. Wiley, if I could start with you, as part of the COVID response, there's been a large focus on testing from the very beginning, but we all kind of struggle to cipher through the different types of tests that there are and what conclusions we can draw from that testing and how that might change our actions at home, in the workplace, and when we're out and about. Could you dig into that a little bit and talk to us about the different types of tests?
Absolutely. So first of all, thank you all so much for this invitation. This conversation has been fantastic. And as a physician, what I want to do to start off is echo everything that everyone else has said about that this is real. It is devastating. It is disproportionately affecting our people. And I take it very personal. So I work at Emory Midtown Hospital. And again, I'm an infectious diseases physician. And what I can say is that 70 to 80% of the patients with COVID who are being admitted to Emory Midtown are Black. And of them, a significant proportion are dying. And people think that these are primarily older patients with comorbidities. That's not necessarily the case. I've seen a 23-year-old die with COVID. Okay, so it's personal. As Black folks, we've always taken care of each other, so we need to do the same with regards to COVID. So to get to the testing, the simplest way to think about COVID testing is you have viral testing, or which is used for diagnosis, or you have antibody slash serology testing. So there's a group of 5 groups of folks who would qualify for the viral testing. So essentially the virus testing, this is when patients or anyone in the community are getting swabbed in their nose or their nasopharynx, or if they're in the hospital, where you obtain respiratory secretions and you're sending that off to specifically test for the virus. So the first group would be the people who are sick, someone who has fevers and sweats and weakness and shortness of breath. That would be the person that would warrant a viral nasal swab. So let's say we have Mrs. Jones. She's a cute, lovely 73-year-old Black lady who has gone to church, to choir practice, and felt just fine during choir practice and went home, and 4 days later had all of these symptoms. So she would warrant a test. However, also the second group of people who may need a test are those who have no symptoms. However, they have had exposure. So you're worried about transmission. So these are the folks that you want to test to ensure that they don't have the disease so that they don't transmit. So essentially, Mrs. Jones's fellow choir members, they would fall into that group. There's a third group of people who have absolutely no symptoms and no exposures. So who would fall into that group? So that may be someone in a long-term care facility, in a nursing facility, correctional facilities, where if one person developed disease, it could have a marked significant effect on the entire location. The fourth group that may require the virus test is testing someone to ensure that they've had resolution of infection. So let's say Mrs. Jones is admitted to the hospital. We're lucky enough that she's fully recovered from her disease. However, before going back home, she actually needs to go to a rehab facility. So what we're having are rehab facilities and some other locations are saying, we need you to retest the patient before they come to our facility. And last but not least, so the fifth group that may warrant these swabs are if you just want to know, just in general, and this is like for public health surveillance, where if the Department of Public Health or a church or someone is offering just free testing, a lot of times we use that to kind of figure out in this specific particular location how many folks are actually infected, how many folks have the disease. So the key is for viral testing, what you're looking for is diagnosing the disease. So I'm glad that you all are asking for me to talk about the antibody testing, because I think there's a lot of misconceptions about antibody testing. Some folks are saying, oh, if you get an antibody test and you have been exposed and your antibody test is positive, that you're safe and you're fine, you can kind of go about your way. That is absolutely not true. The antibody testing, it's a blood test. All it tells you is that over the past several months, at some point you were exposed to the virus. Might have made you sick. However, there are a lot of people who are completely asymptomatic and have no symptoms at all. So all it tells you is, hey, in March, you were exposed to someone who had the disease and you have antibodies. Does it mean that you can never get the infection again? Absolutely not. Does it mean that if you have antibodies that you can't get the infection and pass it on to someone else without having symptoms? It does not. So we never recommend it for diagnosis. I also want the community to know that there are a lot of I'm not going to call them fake tests, but they're not great tests where they'll say, oh, we'll prick your finger and give you those results. Those are not very accurate. With regards to, let's say you find out that you have the disease, I think there's a lot of education out there. Everyone knows to ensure that they're quarantining themselves, staying 6 feet away from someone, staying away from your family within the household, being careful to stay away from folks at least until you're completely asymptomatic, and ideally a few days afterwards. We get a lot of questions about how often should I get tested? Like, I got tested, I had my nasal swab, it showed that it was negative. Do I need to get tested again? Not necessarily. There are a lot of people who are curious and they get tested every so often, just to check on themselves. Great, but that it's not absolutely indicated.
Thanks for that, Dr. Wiley.
Absolutely.
Taniela, I know you're deep in the work of making testing more available across Atlanta, and have been a huge part of that response. I'd love to just hear a little bit more about how CORE first came to Atlanta and about your work in our communities.
Yeah, no, thank you all for having me. I really think this is a great conversation, especially because the information is not accessible to all, and the information coming from trusted communities is the best form of communicating it to these communities, and so our communities. And so CORE is a nonprofit. It stands for Community Organized Relief Effort. And so CORE started about 10 years ago. It's based in LA, and they were responding to the crisis for the Haiti earthquake. And so they started this organization to respond to the Haiti earthquake. And they have been basically working with crisis relief over the last 10 years since. They've worked in various communities in the Bahamas, Puerto Rico, and now in the US. CORE really took a leadership role in trying to get COVID testing, accessible to very vulnerable populations. In the beginning, a lot of us were hearing about COVID testing being available to only those with symptoms, a lot of people could get it maybe through their private doctors if they were insured and things like that. And so it was excluding a lot of our communities, a lot of vulnerable populations. And so what CORE did was that, they were able to get funding. They were doing testing in California, and then they were able to secure funding to be able to expand to various cities that we consider hotspots that were spiking with high cases for coronavirus infection. And so that included Atlanta, that included Chicago, that included Detroit, that included New York. And so a lot of these hotspot areas. And so they came to Atlanta in April 30th. And we came to Atlanta and partnered with the Author M. Blank Family Foundation. They were very helpful in giving us seed funding to start our operations here, in addition to partnering with a local organization called Project South, who is working to eliminate poverty and genocide in like a lot of the Southeast communities, a lot of Black communities in the area, and they've been doing that over 30 years. And so we partner with those two. You would say one gives a lot of the funding, but the other one also is a CORE, a really essential testing partner. And they were helpful in being able to, provide outreach. They know the communities the best, so they know how to get the information to the communities. And so that has been our really unique model of really allowing community organizations to guide our efforts. We are not the trusted group. You don't necessarily know us, but we want to make sure the testing can be provided to those in the most vulnerable communities. And that's been, I feel like our really unique, our unique efforts. And in the last 7 weeks since we've been in Atlanta, we've tested over 22,000 people. Nationwide, CORE has tested over 500,000 people, and that includes communities in California, Chicago, the Navajo Nation, New Orleans. We were also in North Carolina, Washington, D.C., and now New York. And we are also doing like pop-up testing, and we call them like striker teams, where we're sending teams to do pop-up testing in those hotspot communities, even surrounding the states of Georgia soon. And so that's kind of what we have been doing. In Georgia specifically, we've been in Hall County. We've done pop-up testing in Savannah. We did testing in DeKalb County, specifically in the Clarkston community, where we tested over 500 people in that multicultural, multilingual community in Clarkston. We were also able to we partner now more formally with the Fulton County government. And so Fulton County Board of Health has allowed us to, has provided us a stationary site at their Alpharetta site. It's basically a hub for testing daily. And then we also have now pushed out a mobile unit model that allows us to maximize on our testing resources. So in the beginning, when we started out, we had 2 stationary sites. We were at the Home Depot, Mercedes-Benz lot, and we were also at the Project South, location. And of course, we were getting tests. We were doing tests regularly, but we started to see that the number of testing and people getting tested started to die down. And you start to think about ways in which we can basically bring the water to you so that you can drink the water, basically. And so we wanted to create that model and bring testing to the populations. And so we've really been partnering with, I would call them our testing partners. We partner with churches, so the local Black churches, the Hispanic communities. We've worked with. We also were out on Beaufort Highway, and so we tested the large Hispanic community out there with the Latino Community Fund, Georgia. And then when I mentioned our testing with the Clarkston community was through the International Rescue Committee in Atlanta. And so we partner with various organizations that are working in these communities already so that we can make sure we are providing this testing. A lot of the vulnerable populations, transport can be an issue. And so, like I said, being able to provide this mobile unit model has just been transformative, and we are able to test as many people as possible consistently. And so, yeah, that's kind of a summary of our work in Atlanta and what we've been doing, and really, trying to be consistent in partnering with those who want to partner with us. I mean, it really is as simple as that. If you want a testing unit, a mobile testing unit to come to your church parking lot, we also launched a protest and test initiative where we were actually going to the areas where people were doing protesting, because we were trying to really market the whole safe activism. As you know, racism is basically a pandemic itself, and so we don't want to have people having to choose whether or not racism will kill them or COVID-19. And so being able to provide information, being able to really give people kind of a guide on how they can practice safe activism, because you need to do it. You need to be able to use your voice. You need to be able to demand your human rights, but you also know that COVID is real and you need to be tested and you need to protect yourself as well. And so we've been doing various initiatives, just trying to make sure we're, meeting needs as they change. Because as you all have mentioned, COVID-19, everything related to COVID-19 changes every other day. And so we're changing with the times, and we're really just trying to offer testing to anyone that needs it. And I mean, that's the really big initiative our efforts here in Atlanta.
Daniela, I want to pick up on a few things you just said. So one is you are willing to partner. So if folks want to partner with you and make testing available in their community as community leaders, how can they be in touch?
So basically, Core Atlanta, we have a scheduler, and we have our scheduler working each day, just checking in with people to see who might, doing even cold calls to see who wants to be tested. But it's always great when people just call us up. We can be reached through the social media for Core. So Core Response, we're on Facebook, on Twitter. We also have our website where you can find more information, coreresponse.org/COVID-19-Atlanta. So people can check there for more information, to donate, to volunteer, to get tested. You'll see on a weekly basis, we put our testing site locations there so that you would know where are we testing throughout Atlanta on a regular basis. It's up there right now. We're testing usually Monday through Saturday. We also even offer, which I think has been really great, since you all were talking about businesses, we are also trying to partner directly with businesses to get their employees tested. We have a partnership right now with the YMCA where we're testing their campers. And I'm working on partnerships to partner with schools and, public school districts, private schools, because students will have to go back to school. And so these are the kind of partnerships we're working with. we welcome the gathering spot if they want to, let us come and set up in their parking lot and do testing for their community. We're really open to it. It really doesn't require, as long as you have a parking lot, we can figure it out. Have a space where we can come. That's basically what we need for you to help us set up. We have, various criteria if people are able to provide, maybe some in-kind support. Let's just say, for example, when we have our staff out, porta potty and things like that, just basic things that would help make the testing more, I guess, just, easier to do. And so, but we work it out. We're in a lot of tight spots and we get real creative with what we're able to do. But if anyone wants to become a testing partner, if anyone wants to be an outreach partner, because we need as many people as possible to push out the information to the communities to tell them that we are testing. It's like, hey, we're here. But if they don't know we're here, then we're basically just sitting ducks and we're wasting the testing resources. So yes, they can reach out to us. They can email me at Teniola, TENI-OLA .Ogunjobi, OGUNJOBI at coreresponse.org, and I will set them up. I work with partnerships as well as doing the community outreach and supporting a couple of the teams on the East Coast as well. So I will make sure that we get that going. And just visit our website and you'll be able to reach out to us there. And we're always looking to partner. We really want to bring this testing to as many people as possible.
Awesome. And Teniola, I heard you loud and clear where you said that we will know where you are next through your website, so that all your next mobile testing sites for the next week, 2 weeks, they're up there and they're updated. And that's how I know that when I drive by that urgent care that said they've been full since 11 a.m., I can go on your website and figure out where CORE is testing today.
Yes, and testing is free. It's free, you all. No one should be charging you for testing. It is free. Please come and get a test. And I know Dr. Wiley mentioned that retesting is not a requirement, or people are not really putting that messaging out there. But just to be clear that, you're testing and that's capturing that, in the moment, your status. And so you could go out here, which of course outside is open. And so you're out here and you may be exposed to people. And so you need to get retested. I work in the space where we're doing the testing. And so I'm testing every 2 to 3 weeks. And I've done the nasopharyngeal test, which, people say it goes really far back. I've done the shallow nasal swab. I've done the oral testing. And I was just in New York and I did the antibody. And so I've done all the testing. And so I'm still here. It was not a harmful thing. And so please get tested. It really is simple. It takes you're counting less than a minute to do the test. And sometimes processes are as easy as 5 minutes. So please go get tested. We're not asking for any ID. You don't have to, show us anything. We're just only asking for information that allows us to reach back out to you to give you your results. And if you don't have a contact, we have an intermediary that we can allow you to follow back up with to get your test results. And so we're basically trying to make sure there are no barriers for you to get tested.
Teniola, thank you so much for sharing that with us and for the awesome work that you guys continue to do in our communities. We really appreciate you guys being here. Dr. Wiley, I wanted to switch gears a little bit and talk about what's on the horizon, really thinking about medical prevention and treatment and the landscape for clinical trials and vaccines. I'm curious about what's out there and what's coming, but also what our communities of color, Black community, should understand about vaccines and promising drugs.
Absolutely. So Teniola, first of all, thank you for that amazing work. So I've learned a lot about what you're doing in the community. It's fantastic. So with regards to prevention, right now, what we have for prevention is keeping ourselves and keeping other folks safe. The one thing that I don't feel like the community is fully aware of is not just wearing a mask, but being aware of the fact that your mask, if I have on a mask, I'm actually offering more protection to you, okay? And if you have on a mask, you're offering a lot of protection for me. So I feel like there's a misconception that, if I go to the grocery store and I have my mask, or if I'm double masking, that I'm okay. However, I'll be honest with you, if everyone else in the grocery store does not have on a mask, they are not offering protection for you. So, we talked a lot about that sort of prevention with regards to wearing your masks, keeping things clean, socially distancing, et cetera. So with regards to vaccines, what we're all hoping is that we'll have a vaccine ideally by the end of the year, may not be until the beginning of 2021. We don't know the answer. We hope that we'll have a vaccine, and the most important thing is when we have one and when we know that we have a safe one, that it's going to be important for everyone who is eligible, which should be all of us, to go out and get one. But until we get there, it's all about social distancing and wearing your masks. Now, with regards to treatment, if you're unfortunate enough to end up diagnosed with COVID, one of the good things is everyone who has COVID, number one, doesn't have symptoms. So there are a lot of people who are completely asymptomatic. There are people, especially the young and healthy, those without a lot of comorbidities, may get the disease and they're well enough to stay at home. However, if you're admitted to the hospital, most of the treatment right now is what we call supportive therapy, which is, if you're having high fevers, we give you Tylenol, we give you IV fluids, supplemental oxygen as needed. The treatment and trial landscape has been rapidly changing. I'm sure a lot of you all remember a lot of talk about hydroxychloroquine, and then a few months later, what we know now is that it's not very safe. There are two main categories with regards to treatment, and one are what we call antivirals that directly act on the COVID virus. And there's one called remdesivir, which is actually, we're hoping that it'll actually become FDA approved earlier rather than later, because a lot of the early studies have shown that patients are getting out of the hospital earlier and are less likely to die. So antivirals, the remdesivir, and we also have anti-inflammatories, particularly steroids. There's a study with regards to dexamethasone that we're seeing actually causing a lot less severity of illness, and especially in our critically ill patients. Other trials that are out there, I looked at clinicaltrials.gov this evening, and there are 2,330 trials worldwide on COVID and 37 right here in Georgia. Most of the studies are for, I think a lot of us have heard about convalescent plasma and a lot of anti-inflammatory agents that are used in other illnesses, including rheumatoid arthritis, et cetera. So biologic agents, anti-inflammatory agents, but the most important thing is supportive care. We have a lot of trials going on within our hospital systems, at Wellstar, within Emory Healthcare, at Grady. What I would tell our people of color is to be open to the conversation, because I'll be honest with you, we have a lot of hesitancy, understandably, with regards to trials. I'm from South Alabama. I know everyone knows about the Tuskegee trial, so a lot of our people are very hesitant about signing up for trials, and it's pretty scary for them as well, being in the hospital by themselves, feeling really sick, not having their families, and someone coming in to talk to them about something that has not been FDA approved. So I think as we're speaking to people to our people in the community about, if you end up in the hospital and someone offers trials, is to try to be open-minded about it. If you want the physician or the provider to talk to your family, that you have that right for us to explain things to your family, that at any point in time, if you sign on for a trial, if you say, I don't want this, then you can always change your mind. So it's all about being open, listening to patients, communicating with their families, and also our Latinx community has really been affected over the last, especially over the last couple months. So ensuring that, there aren't those language barriers, and that we're using our interpreters to explain everything to our Latinx population. So there's a lot on the horizon, rapidly changing landscaping, and when we have vaccines, hopefully within the next year, we should sign up for them.
That's awesome. It's great to hear about what is on the horizon. I think a lot of us have felt a lot of paralysis at some point in the last few months of what do we do, where do we go? And I hope that this conversation, not just with Tangela and Dr. Wiley, but also throughout this entire summit, has really allowed people to engage and not feel as afraid of the data, not feel as afraid of kind of knowing how best to protect yourselves and to be respectful to others to protect them. I'm part of Emory's steering committee, the COVID community outreach committee, and we are really trying to dig deep into the root causes of the disparities that exist and work with community members to develop and implement effective interventions, whether we're looking at data and visualizing it to guide action or trying to amplify messages through multiple channels. We really want to leverage this power to convene. So Ryan and the Gathering Spot, thank you for providing this platform. We're really grateful to have been part of this conversation today.
Dr. Smith, I appreciate you. And I want to first thank all of the panelists that shared all of their knowledge with us this evening. I think that so much was shared, and I learned a lot personally, and I hope that everyone that's watching did as well. My second thanks really goes to Emory Healthcare and to Emory Hospital. Thank you first for the work that you're doing, being on the front lines of this issue, and for all of the practitioners that work day in and day out to try to keep us safe as a community. Also, thank you for taking the time to share this information with us. As was mentioned several times this evening, even though that this is a big topic of conversation, good information a lot of times is hard to come by. So thank you, Emory, for your partnership, and we look forward to continuing to do more work with one another. Finally, I want to thank everyone that's watching. It is important for us that take the time to really engage in these topics to know that it is our duty in many ways to share this information with folks that are not here. So please continue to make sure that this conversation stays alive and well so that we can all get to an outcome where lives are protected and that folks don't have to deal with the complications of contracting this virus. So with that said, thank you for spending your time with us. You could have been anywhere in the world, and we appreciate you spending some time with us here this evening. Look forward to more information and more conversation as time goes on. Again, thank you to Emory. We will see you all soon.
Thank you.
Thank you.
Thanks, everyone.
Thank you.